Have you ever felt a sudden, sharp pain in your eye and immediately wondered, is this just irritation or is something really wrong? Welcome back to Eye Health Insights. I'm Dr. Joseph King, and today we're talking about eye pain, what it means, what commonly causes it, and how to know when it's something that needs urgent attention. Here's what we'll cover today: the difference between surface pain and deeper internal pain, the most common everyday causes, the serious but less common conditions you should know about, and the clear warning signs that mean you shouldn't wait. First, let's start with something important. Eye pain itself is not a diagnosis, it's a symptom. And the key to understanding it is figuring out where the pain is coming from and what other symptoms are happening alongside it. In general, I think about eye pain in two big categories. There's pain coming from the surface of the eye and pain coming from deeper inside the eye or even around it. Let's start with surface pain because that's by far the most common. The front of your eye, especially the cornea, is incredibly sensitive. In fact, it has one of the highest concentrations of nerve endings anywhere in the body. That's protective. It's designed so that even a tiny speck of dust triggers blinking and tearing to protect your vision. But that also means small problems can feel disproportionately intense. One of the most common causes is dry eye. When your tear film isn't stable or balanced, the surface of the eye becomes irritated. Patients often describe burning, stinging, or a gritty sensation like there's sand in the eye. Sometimes it fluctuates throughout the day, especially with screen use, air conditioning, or windy environments. Another frequent cause is a corneal abrasion, essentially a scratch on the clear front surface of your eye. This can happen from rubbing your eye, getting debris in it, a tree branch brushing across it, or even from contact lenses. Abrasions typically cause sharp pain, tearing, redness, and significant light sensitivity. Many people say, it feels like something is stuck in my eye, and that sensation can be very strong. Infections are another possibility. Conjunctivitis, often called pink eye, can cause irritation and redness, though it's usually more uncomfortable than truly painful. But when the cornea itself becomes infected, a condition called keratitis, pain can be much more severe. Contact lens wearers are at higher risk, especially if lenses are worn overnight or not cleaned properly. Now, let's shift to deeper pain. If the pain feels more like pressure inside the eye or a deep ache behind the eye, we start thinking differently, especially if it's associated with blurred vision, headache, nausea, or halos around lights. One important cause is inflammation inside the eye, called uveitis. This can cause aching pain, light sensitivity, redness, and blurred vision. It's not something that improves with over-the-counter drops. It requires medical treatment to calm the inflammation and prevent complications. Another condition I always mention, because while it's rare, it's serious, is acute angle closure glaucoma. This happens when fluid inside the eye can't drain properly, causing a rapid rise in eye pressure. Symptoms can include sudden severe eye pain, headache, nausea, vomiting, blurred vision, and seeing rainbow-colored halos around lights. That combination of symptoms is an emergency. Immediate treatment is critical to protect vision. Now, here's something that surprises many patients. Sometimes the eye itself is completely healthy and the pain is coming from somewhere nearby. Sinus infections can cause pressure and aching around or behind the eyes. Migraines can frequently cause eye pain, often with light sensitivity and visual disturbances. Even tension headaches can create soreness around the eyes and brow area. So the real question becomes, how do you know when to worry? Well, here's a simple way to think about it. Mild irritation, especially if your vision is completely normal, is often related to dryness or surface irritation. It may improve with artificial tears and rest. But eye pain combined with decreased vision, significant light sensitivity, nausea, severe headaches, halos around lights, or recent trauma, those are red flags. Those symptoms mean you shouldn't wait. Chemical exposure is another situation where time matters. If anything splashes into your eye, cleaning products, chemicals, even something seemingly mild, rinse immediately with clean water for at least 15 minutes. Don't delay. After rinsing, seek medical care right away. Let's talk about what not to do. If your eye hurts, avoid rubbing it. Rubbing can worsen scratches and increase inflammation. If you wear contact lenses, remove them immediately. Do not put them back in until you know what's causing the eye pain and your eye has fully healed. And avoid using leftover prescription eye drops unless they were specifically prescribed for this exact issue. Some drops, especially steroid drops, can actually make certain infections worse. From a patient perspective, I understand how anxiety-provoking eye pain can be. Vision is precious. When something hurts, it's natural to jump to worst-case scenarios. The reassuring news is that many causes of eye pain, dry eye, minor abrasions, mild infections, they're very treatable and they resolve completely with proper care. But the key is appropriate evaluation. The eye is a small, delicate structure. It doesn't tolerate swelling or pressure changes very well. So when something more serious is happening, early diagnosis makes all the difference. If you're experiencing persisting pain lasting more than a day, worsening symptoms, or any change in vision, it's worth scheduling an exam. Even if the outcome is reassuring, having clarity and peace of mind is valuable. Eye pain is your body's way of saying, pay attention. Sometimes it's a minor irritation asking for lubrication and rest. Sometimes it's a signal that needs urgent care. Listening to that signal and responding appropriately is what protects your sight. If you're noticing changes in comfort or vision, don't ignore them. A simple eye exam can help identify the cause and get you on the right path quickly. Thanks for watching Eye Health Insights. Take care and see you soon.